Hi everyone, it's Dr. Hall here, and we're going to get deeply into the subject of contraception or birth control this week, starting with hormonal contraception. And specifically, we're going to start this first part talking about societal impacts. Before we do that, however, I want to remind you of Ignaz Semmelweis, right? So he was the physician who realized that women having their babies on the physician side of the hospital were dying of childbed fever at a higher rate than women who delivered their babies on the midwives side of the hospital. And he realized that one of the differences was that the physicians would often go down to the morgue and do autopsies, and that they would do this with their bare hands. This was back before medical gloves. And then they would come up and deliver a baby and then go back to the cadaver lab and come up and deliver a baby. And so he hypothesized that there were cadaveric particles that were getting on their hands. And believe it or not, they were not washing their hands before and after touching cadavers. And that these particles then were getting on the women when they did the deliveries of their infants and causing the infection. They weren't cadaveric particles specifically, they were bacteria, which can happily accumulate on your hands if you don't wash them. So he instituted hand washing as a measure to decrease the spread of infection, was phenomenally successful at that. However, the physicians of the time took umbrage at this. They were insinuating that it was their fault that their patients were getting ill, and they were so offended by this that they actually stopped following his recommendations. He was shunned and ended up at the end of his life alone, ridiculed, and died penniless. So for a brief period of time, hand washing did improve the lives of these women, but then people were not emotionally ready to accept the reality of what was occurring, and so they reverted to their previous ways. I want to highlight this story because this is something that happens again and again throughout human history. In fact, the cure for scurvy was invented or discovered at least 3 different times throughout the history of medicine. But then there was someone who later poo-pooed it and said, oh no, that doesn't help scurvy. This other thing does, which totally didn't. And so people then unnecessarily died again for a long period of time. So change can be hard, especially if we are discovered to be culpable or guilty of causing the problem ourselves. That can be difficult to accept. So I just want to highlight this story because it's really important if you're working in healthcare or in any field to be constantly aware of the possibility that you are wrong, and to always be open to considering the possibility that you are wrong and you could be making a mistake. And so therefore to look at the data, to look at the evidence, and then change your practices accordingly. While we're on the topic of maternal mortality, I just want to give you an illustration of what that looks like. So back in the 1800s, we don't have a lot of records, but Finland actually was keeping some records in the 1800s. They're here in blue. So you can see that maternal mortality was about 1% for much of the 1800s, and then it started to decline in the late 1800s into the 1900s, right? So we start to see a significant decline. This is primarily due to hand washing and disinfectant techniques, right? We didn't invent our first antibiotics until the 1930s for the most part, and that kind of helped get maternal mortality the rest of the way down. Overall, for most of these countries, maternal mortality is 1 in 10,000. However, keep in mind in the United States, we have disproportionately high maternal mortality of 1 in 5,000, owing in large part to our disproportionate mortality rates in African American women because they are subject to systemic racism, they are disbelieved, they are poo-pooed, they also have less access to health care. Not only has maternal mortality decreased over time, but infant mortality has decreased incredibly over this period of time. Again, mostly due to improvements in hygiene. In fact, probably the deployment of sewage systems and toilets has done more to protect infant and child health than anything else. And then we can see once antibiotics were introduced, it further decreased. Malnutrition would also be a large cause of infant mortality. Worldwide, globally, you can see here that in 1800, almost half of children didn't survive the first 5 years of life. So child mortality has historically throughout the human condition been very high, and it's only been in the last 150 years actually that we've really made huge strides in decreasing child mortality. And so for much of human history, trying to prevent pregnancies was not the same calculus as it is now, because many years ago you would have a lot of children knowing that almost half of them probably wouldn't survive to school age. So it was common for people to have many babies with the understanding that almost half of them would not survive. And if you look back at the histories of people, you hear tale after tale of many children dying when they were young, and certainly before they reached adulthood. So this wanting to prevent pregnancies so that you can decrease how many children that you have is something that is in some ways a little bit relatively new for human history. So that brings us to actually talking about contraception or birth control itself. So contra means against, ception is referring to conception, right? That fertilization event. So, or against fertilization, we are preventing pregnancy from occurring. Contraception, birth control. So the impacts on society have been huge. So the story of the invention of the birth control pill goes a little bit like this. This gentleman over here is Gregory Pincus. He was a scientist, and he was at Harvard actually, and he was studying reproductive biology, and in fact did the first in vitro fertilization in rabbits. And this was an incredible breakthrough in reproductive biology, but was also seen as kind of like creepy, like he was a mad scientist, creating life in a test tube. And so he actually didn't get tenure at Harvard, and so found himself kind of adrift and started working at a private laboratory, and was, continuing to work, especially on the progesterone itself and how that worked. So then along came this woman. This is Margaret Sanger. Margaret Sanger was born to an Irish-American family. Her mother had over 15 pregnancies and died young in her 40s. And Margaret really believed that all of those pregnancies had taken a toll on her mother's health, and saw how kind of tied and almost enslaved to children in child rearing her mother was, and thought that it would be really important for women to be able to control their childbearing. And in fact, she started breaking the law and teaching women about how to not get pregnant by kind of timing intercourse to their menstrual cycle, and also by teaching them how to use diaphragms, which we'll talk about in the next lecture. They're a barrier method of contraception, one of the few methods that was available at this time. Now, I mentioned it was against the law. So we had Comstock laws, which were laws against indecency, and they forbid the dissemination of any information about prevention of conception. So she was a staunch advocate for birth control and making it accessible, and she found out about Dr. Pincus and his work and thought, well, wouldn't it be amazing if we could use science, right, of reproductive biology to create a pill that women could take that would allow them to prevent pregnancy. So she then ended up getting in touch with this woman, Catherine McCormick. Catherine McCormick married a husband who was heir to the International Harvester Corporation, and so a very wealthy family. She was an interesting woman. She was the first woman to graduate from MIT. She had a degree in biology. And also, interestingly, her husband ended up having schizophrenia and was quite ill. And Catherine vowed to remain childless because of this. And was then keenly aware of the challenges inherent in not getting pregnant as a married person. And so she was uniquely situated because she had this biology degree, she was a scientific thinker, she had money, and she had a lot of interest in preventing pregnancy. So Catherine McCormick then agreed to fund research for Dr. Pincus to develop a female contraceptive. So Margaret Sanger got Catherine McCormick on board. They funded Dr. Pincus to do research, which he did in animals, and he found that giving progesterone to animals could prevent ovulation and prevent conception. But the problem was that Dr. Pincus was a PhD doctor and he could not give medication to humans. So then they had to enlist this gentleman here. This is John Rock. He was a famous OBGYN reproductive endocrinologist in Boston. He was also a devout Catholic, which was very interesting. And so they recruited him to help run human trials of the first contraceptive. So they did run some experiments in Boston, but they had to do it kind of hush-hush because birth control was still illegal, especially in Massachusetts, which was a very Catholic state at the time. And so eventually then they did a clinical study in Puerto Rico. This was problematic for many reasons. Certainly in Puerto Rico, there was a lot of interest in a female-controlled contraceptive, and it was a time when society was really interested in science and helping science. The problem came about because when they enrolled women in the study, they did not properly educate them on the potential risks and benefits. And additionally, when some problems did occur, there were some deaths in the women taking the birth control. They just kind of brushed them under the rug and they didn't take it seriously and they didn't investigate the causes of those deaths. So this was a serious ethical breach. And we'll talk about that again when we come back and talk about sexually transmitted infections. There have definitely been times in our medical history when we have taken advantage of vulnerable populations and not done our due diligence. Anyway, in 1960, the first birth control pill, Enovid, was approved for use, and this resulted in huge shifts in society. So for the first time, women could control and time their own childbearing. Now you might say, oh, but weren't condoms around? Yes, but they weren't used. They were felt to be only used for people who were kind of degenerates, and diaphragms were difficult to access and to use. So this was a huge new thing, much more effective than previous methods. So this meant women had more sexual freedom. They could be sexually intimate with their partners without risking getting pregnant. It also meant that since they could time their childbearing, they were more able to work outside the home. Now, this may seem strange to us now, but back in the 60s, if a woman got pregnant, she would often be let go from her job and then not be hired back because the assumption was after your baby was born, you needed to be a full-time stay-at-home mother. Even school teachers, once they got past 3 months pregnant, they were dismissed from their jobs because it was felt to be, I don't know, too titillating for the students to see a pregnant woman. So it was impossible to have a career or to go to a graduate or professional school, right? To go to law school, to go to medical school, if you were potentially going to get pregnant, and that could interrupt that whole process and could completely derail your career. It also allowed women to have smaller families. Right now that our children are living longer and surviving, it was a way to have smaller families. So these were huge shifts for our society. It's also a new type of medication for the pharmaceutical companies. So this is a medication that you don't take just when you're sick and just for, a few days to weeks. This is a medication that healthy people would take every single day for years. So while on the one side it was controversial and some pharmaceutical companies didn't want to touch it because of kind of the ethical and moral implications of a birth control pill, on the other hand, this is the potential to be a huge moneymaker, right? Millions of potential takers, consumers, right, would take this every single day for years and years and years. So this is an entirely new type of medication for the pharmaceutical industry. The pill also originated medical activism. So what happened was, remember I mentioned in the early days in Puerto Rico, there were some deaths and they were not properly investigated. The pill was released in the United States in 1960, and within years, millions of women were taking it. Reports started to trickle in. Previously healthy women having heart attacks, having strokes, dying, having blood clots in their lungs. And this became really concerning. And so they actually held congressional hearings. So Congress called a special session to discuss what was going on. And during that panel, of course, almost all of the Congress people were male, and almost all of the experts giving testimony were also male. And there was a group of women who started attending the hearings and started disrupting and protesting the hearings and saying, these are our lives on the line, you're treating us like guinea pigs, this needs to change. And so this was the beginning of some medical activism. So the women protested the hearings and they demanded two things. One was more accountability from regulatory agencies, right? They said, we assumed since you approved this for sale in the United States that it was safe, but yet it is causing deaths and cancers, they believed at the time. So you need to do a better job. And so, in fact, it did cause them to study the pill more carefully, decrease doses significantly, which decreased the risks to people taking them, as well as provide information about the potential risks in the package, right? So if you buy birth control pills now, you'll get this whole package insert that has all this type of information about potential side effects or adverse effects that can happen from the medication. That happened as a result of the women protesting these hearings and demanding these things. It also caused women to demand a more egalitarian and less patriarchal relationship with physicians, by which I mean they needed to be on more equal footing. Again, it seems really strange to us today, but even as late as 1970, and so the video clip that's posted here and in Canvas is from a popular movie in 1971. And in the scene, the physician is talking with the husband of the patient. And so I encourage you to take a minute and watch it. And so at that time, women were not told what was going on with them. The physician would talk to the husband. Remember, at this time, even as late as 1970, a woman could not hold a credit card in her own name. I still remember my mother pulling out her credit card when we went to Sears, and it said Mr. Thomas Hall on it, right? So things were very different, and so women started demanding that they were participants in their health care and that they had the right to know the risks and benefits of any potential treatment. So this was huge. So today we have what some people call a contraceptive mentality, right? It is expected that for the most part or often people will plan when they have their children. Now this is definitely not always the case. In fact, about half of all pregnancies in the United States are unplanned, but about half of them are planned, and that does allow for school and work, our career, financial planning, right? All those types of things. And in fact, it was deemed as so important for women's rights to be able to plan when and if they would have children that President Nixon, right, who's a Republican, was actually the one who started federal support for Planned Parenthood, because Planned Parenthood is primarily an agency that allows people to plan parenthood. So most of what Planned Parenthood does and did then and still now is provide access to birth control, right, so that people can plan when they have children. So the federal government continues to have some involvement, right? We no longer fund Planned Parenthood for interesting reasons, even though we've always had rules that forbidded any federal dollars from funding abortion, which is a small proportion of what Planned Parenthood does. But the Affordable Care Act, which was passed in about 2008, often known as Obamacare, was a healthcare law that primarily talked about health insurance and had lots of important details in it to help protect the people who are buying these health insurance plans. But the one I want to point out to you here is one of the provisions of the law is that birth control has to be covered. So you have to not have to pay out of pocket for birth control. You don't have to have a copay for birth control. Birth control must be covered. Now, they made an exception for religious organizations that would have a moral objection to that. Here's some more of the stipulations of the law in case you are interested in understanding what's in it. We also have in the state of Wisconsin something called family planning only services, which allows for reproductive health services for people who don't have their own personal insurance plan. So if you live in Wisconsin and are a U.S. citizen, you don't have to be a quote official Wisconsin resident, you just have to have an address here, and you make less than about $3,000 a month and don't have your own personal insurance plan, right? So if you're on your parents' health insurance plan, you're still eligible. You can get on this program. You get free birth control, including condoms and emergency contraception, which you may know as Plan B. You can also get free STI testing and treatment. It's an incredible, incredible program. So this is the website that you can use to apply for it. As a healthcare provider, this has been huge for me. I've worked in other states that didn't have this, and I had to have really difficult conversations with young adults about how we were going to keep them from getting pregnant. But here in Wisconsin, we don't have to have that agonizing discussion about how much they can afford, right? Same goes for STI testing. It's a marvelous program. So anyway, back to the Affordable Care Act. So starting in 2008, contraception was then more accessible. Many of the provisions of the ACA allowed for more people to get health insurance through both the marketplace, expansion of state Medicaid programs, and by allowing dependents to stay on their parents' plan until age 26, which might be why many of you have health insurance. And then that insurance had to cover birth control. So it was much easier for people to get birth control because they could afford to go for the doctor's visit to get the prescription. They didn't have to pay out of pocket for the prescription or pay huge copays. And so that has had huge impacts in just the last decade or so. Our rates of unplanned pregnancies have dropped significantly by more than 5%. Teen birth rates have dropped even further than that, and abortion rates have also dropped significantly, right? If you can prevent an unplanned pregnancy, then you've potentially prevented an abortion. So what we can see in this chart here, and this is divided up by race and ethnicity, is that overall, abortion rates were already going down. And you might ask me why, and I would say it has to do with a form of birth control that became more available, that we're going to talk about in the next lecture. But then you can see this huge inflection point in 2008, where all of a sudden the curve starts declining even more significantly. That's when the Affordable Care Act came into effect. So it's really encouraging to see that abortion rates, right, decline significantly when you make contraception accessible. Now, because there are fewer unplanned pregnancies, there are not only fewer abortions, there are also fewer babies being born. So overall, birth rates have been going down. And some people talk about this, oh, this is a terrible thing. It's actually not such a bad thing overall, especially if you think about the state of our planet. But it does have economic consequences because of how we've set up our system, right? So currently Social Security and other benefits are paid for by the salaries of the people who are working. So when our population was increasing exponentially, that was easy because you always had more working people than you had retired people. But now that we're living longer overall, so we spend more years in retirement, and that the birth rate is declining and we have fewer younger people, the ratio is changing, and so that has profound economic impacts. So this ability to decrease risk for pregnancy is huge. And I oftentimes hear people say things like, well, if you're not willing to potentially be a parent, then you just shouldn't have sex. That works for many people. However, I've been working in healthcare and with lots of different people in lots of different situations long enough to know that it's not feasible or reasonable to expect that everybody who doesn't want to have a child can simply not have sex or can simply use a condom correctly every single time and have it never break. That's a big ask for some people, and it does not mean that they therefore should be saddled with unwanted parenthood, especially if they weren't responsible enough to use birth control. Then I don't know if they're responsible enough to parent, right? So just kind of understanding human nature. For some people that will work. For some people saying, well, if you don't want to have a kid, you shouldn't have sex. That's great for the people in whom that can work. But there are lots of other people in our society for whom that is not going to work for a wide variety of reasons, some of which are within their control and some of which are not. So the ability to decrease folks' pregnancy risk with birth control is huge. There are lots of reasons to not have a kid, right? Maybe you already have one or more. Maybe you can't afford it financially. So it's very expensive to raise children and to put them in daycare and to feed them and clothe them and send them to school. And our society does not give a lot of support financially for those things. Maybe you're just not mature enough to be a parent, or you need to finish school first, or your career plans won't accommodate that right now, right? You can't take time out. You have to work long hours right now. Or maybe you're not in a supportive, committed relationship. Maybe you're even in an abusive relationship, which then would be really dangerous for you and the child. Single parenthood is extraordinarily difficult, even if you have all of the financial resources, which most single parents do not. Maybe it's not medically safe for you to get pregnant and have a child. It's not common, but there are medical conditions, and I have had patients for whom I have said it would be very dangerous for you to ever get pregnant, right? So there's some people in whom pregnancy is kind of medically contraindicated. Or maybe you have a genetic trait. Maybe you have something like Huntington's disease and you're not sure that you want to potentially pass that on to an offspring. Or quite simply, maybe you just don't want to be a parent. And certainly some of the lousiest parents are the people who don't want to be parents, right? Or maybe you'd be a lousy parent for a variety of reasons, either right now or ever, right? Some people just don't want to have children, and that's okay. And that doesn't necessarily mean that they shouldn't be allowed to have sexual intimacy. So those are all reasons pertaining to the individual, but people are talking a little bit more now too about how this plays out in our society, in our world at large. So Americans in particular consume a lot of resources and generate a lot of pollution and a lot of carbon dioxide emissions compared to most other people on the planet. So there is a good argument to be made for the fact that perhaps we shouldn't have so many Americans on this planet because of how wasteful we are. Really, we're very large consumers of planetary resources and big polluters of the planet. So maybe we should have fewer Americans. So some people are saying maybe you should only have one kid, right? Maybe you shouldn't replace the two of you if you are in a stable. And then when you think about climate change and all of the things that are happening with temperature rises, more severe heat events, sea level rise, which is occurring and will continue to and may accelerate, the severe weather patterns that we're seeing, the flooding, the wildfires, all of those things that are happening, some people are saying this planet is not going to be nicely habitable for very much longer, right? And so we're already starting to see some of these things, right? We're starting to see climate refugees, people who are moving due to heat and sea level rise, drought, fires, flooding, all those things we talked about before. In fact, many of the conflicts in the Middle East have to do with the degradation of the climate and the environment there. Shortages of fresh water, not only for human consumption, but also for agriculture. So our region of the country is expected to become a bit wetter, actually, in the climate projections, but many other parts of the world are expected to get even drier and kind of desertification, right, turning into deserts, which is then going to cause problems just for human existence in those places, but also is going to significantly impair our agricultural system. And so because of decreased availability of fresh water, as well as more severe weather events, more flooding, more fires, we're at risk for more crop failures, which could potentially lead to hunger and starvation. So there's a lot of problems that we're headed toward, right? And of course, all of these would cause significant economic disruption. So some people are saying, you know what? I just don't see this being a viable future, and so I'm not going to have kids, right? So there are a lot of people saying that I don't see this planet heading toward a good place. I don't think it's a good world to bring children into, and therefore I'm not going to have any. Sometimes it's for that personal reason. Sometimes it's as a strike to kind of make a statement to try to compel governments to do more to counteract climate change. And then some people say, well, again, kind of back to that environmental region, maybe we'll just have one, right? Maybe we'll just have one kid, but still maybe want to be married and have sexual intimacy, and so therefore want to have access to contraception. So contraception has had huge societal impacts. Women can control their childbearing, which has made them, it's been huge in terms of being able to pursue educational and career paths that were previously closed to them. They can also be more economically self-sustaining. You don't necessarily have to have a husband to be able to survive and make it. It's also this new type of medication that you take every day for years, even in healthy people without a disease. We've seen the impacts of making contraception more accessible. So when you make it easier for people to get birth control, we have fewer unplanned and fewer teen pregnancies, and we also have fewer abortions. And so if it's possible to choose how many or if you have any children, right, there are all kinds of considerations that go into that in terms of financial, educational, career, personal health, environmental and climate considerations, and of course, your ability and desire to be a parent, which is an important part of that decision making. So we'll start on 19B then. We'll start talking about how hormonal birth control works.